Hello friends, how are you all? Hope you are doing well. In this emergency drug series, here comes the time to discuss about the one of the most demanding and most crucial drug, that is amiodarone. Amiodarone brand name is Cordarone. Primarily used to treat and as a arrhythmia, life-threatening arrhythmia, that means irregular heartbeat. So, me Titir want to welcome you all to my channel Nursing Made Easy with Titir. Here there is a discussion on amiodarone. Let's start. Let's start with the mode of action. Before going to mode of action, I want to give you some discussion on repolarization and depolarization of cell. So, when the cell is positively charged, that is depolarization, and when it come in a resting phase, that is a repolarization. So, time, membrane potential, and here comes the depolarization phase, and here comes the repolarization phase. Amiodarone acts on sodium channel, potassium channel, how it works on sodium channel? So, in sodium depolarization, what happens? In such cases, all the cell membrane became positively charged. And how? Because when sodium enters in the cell, it takes its positive charge into the cell. So, our cell became positively charged and depolarization happens. It acts on our heart muscles. Amiodarone acts on our heart muscles and it delays the process of depolarization. Okay, let's come to the repolarization. What happens in repolarization? Now our cell is positively charged, and after depolarization, repolarization started, means this is a resting phase for our muscles. In repolarizations, potassium acts an important role in that cases. In repolarization, potassium comes out from the cell and it took its positive charge from the cell. Before it was all at positively charged. When the potassium comes out, it will all takes the positive charge from the cell membrane. So our cell became resting phase and it became negative. What happens in amiodarone? If we transfuse the amiodarone, in that cases, amiodarone will increase the time of repolarization and refractory period. What is refractory period? So it will also delay the time of depolarization. It increases the time of repolarization and it will also time to act again on a cell membrane. Okay. Third point. It also acts on a calcium channel of a heart muscles and it decreases the excitability of heart. The amiodarone also has some minimal effect on beta blocker and alpha blocker. All those combination of this action helps to decrease the arrhythmia. So this is how amiodarone act on heart muscles. So it will decrease the time of depolarizations. It will increase the time of repolarizations. It also affects in calcium channel to decrease the excitability, and it will also minimal effect on beta blocker and alpha blocker. So all this combination of drugs to help to reduce and became hard to active normal. After mode of action, there is a chance come discussion point on indication where you should use these drugs. So before going to discussion, what is arrhythmia? You should know there is two type of arrhythmia. One is arterial, one is ventricular. In arterial, there are two types. One is AF, arterial fibrillation, and another is arterial flutter. Arterial fibrillation, this is a irregular heartbeat. So in that cases, our heartbeat will be more than 120 to 150 beats per minute. The ECG, you can see there will be irregular RR wave. So RR wave will be irregular for arterial fibrillations, and you can see there is no P wave. This is arterial fibrillation. What is the difference between arterial fibrillation and arterial flutter? In arterial flutter, the RR wave will be regular and there will be this short tooth appearance will be there. Here also no P wave we can find. So this is arterial flutter, this is arterial fibrillation. Both the cases P wave will be not there. You can see heartbeat more than 120 to 150 beats per minute. It also can reach to 200 beats per minute. And the difference is irregular P wave, irregular RR, there is regular RR. This is R, 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 R. RR is regular. So this is arterial arrhythmia. Cordarone effect on arterial arrhythmia. And let's come to the ventricular arrhythmia. Ventricular arrhythmia is more fatal than arterial. So ventricular arrhythmia, first comes VT. VT, regular VT. There is no P wave, only you can see white complex QRS. So this is QRS. Again QRS, white complex QRS. Arterial is narrow complex, ventricular is wide complex. So wide complex QRS will be there, and this is also a regular. We can tell it as a monomorphic VT. Monomorphic VT. So Cordarone also helps to act on monomorphic VT, and ventricular comes ventricular fibrillation. This is very dangerous arrhythmia. So in that case, there will be no regular wave, no PQRST you can find out. There is no such regular things, only fibrillation will be there, ventricular fibrillation will be there. That is also called polymorphic VT or ventricular fibrillation. So all those fatal arrhythmia can be treated with this amiodarone. Amiodarone also act on supraventricular tachycardia. Supraventricular tachycardia is similar with ventricular tachycardia. So there will be regular RR wave will be there. Again, because it is a arterial, so P will be absent. Okay, and there will be narrow QRS. QRS is narrow, less than 3 boxes. So this is supraventricular tachycardia. Some of the cases we used to use amiodarone to treat supraventricular tachycardia also. And lastly, in case of cardiac arrest or refractory arrhythmia, when the other drugs is not acts on, so we will be using amiodarone to treat cardiac arrest scenario after third shock. After third shock, we will be using this amiodarone to treat refractory arrhythmia. Now there comes point to discussion on the dilution and dose. So amiodarone 1 ampule available in this Cordarone. Name is Cordarone. Brand name is Cordarone. 1 ampule is available in pharmacy. It will be available. 1 ampule means 3 ml. 3 ml means 150 mg. So our first dose, loading dose for arrhythmia cases, except cardiac arrest, all those arrhythmia cases will be giving the loading dose 150 mg stat. You have to dilute 150 mg plus 10 ml of normal saline, and you have to administer over 10 minutes. Okay, that means 15 mg per minute you have to administer. This is the stat dose. After stat dose, you have to give the maintenance dose. This is the stat dose. Comes to maintenance dose. For maintenance dose, you have to take 6 ampule of amiodarone. 6 ampule means that is 900 mg. Please dilute with 500 ml of normal saline or 5% dextrose. So our 500 ml dextrose is concentration will be 900 mg of amiodarone. Start with 1 mg per minute for 6 hours. That means if we take 1 mg, 60 into 6, 340 mg you have to give over 6 hours. And second thing, you have to give 0.5 mg per minute for rest of 18 hours. So you have to give 900 mg over 24 hours. So 30 into 18, that is 560 over 18 hours. So you have to complete 900 mg over next 24 hours. This is the standard ICU protocol to administer amiodarone in the treatment of arrhythmia. Next, come to cardiac arrest scenario. In the other arrhythmia, we have administered as a 150 mg. In cardiac arrest, after third shock, you have to give 300 mg of amiodarone, means 2 ampule with 10 ml of NS or 5% dextrose. This is the stat dose in that cases if patient undergone a cardiac arrest. So what is the complications or nursing management you should follow? In case of Cordarone, there is a high chance of phlebitis or there will be some necrosis might be happen. So better if you administer through the central line, or make sure after that line you have to observe for the phlebitis. And next thing, after maintenance dose, you have to also observe for the vital signs, like there will be some bradycardia might be happen. So you have to look on that, immediately stop the medication as per doctor advice. I hope this is fine for amiodarone. Thank you for watching.